Hey tribe, how are you guys tonight? Sorry we're running a little behind. Jaeda was stuck in traffic. Girlfriend lives in Portland, so it's crazy there. All right,
Yes.
so we are going to talk about psych nursing. Jaeda, why don't you introduce yourself?
Hi, everybody. I'm Jaeda Checkley. I'm actually a psych nurse. I've been a nurse for about 10, 15 years now, and I enjoy my job.
Awesome. What do you love most about psych nursing?
I love the continuity of care. I feel like I'm more a part of someone's healing in the long term as opposed to some hospital settings or even clinic settings where you see someone and then, you send them about their way.
True. All right, good. So, we're going to talk a little bit about your experience as a nursing student, and then we'll get into your experience as a nurse in psych. So, did you have any hardships in nursing school?
Um, I think my hardships in nursing school were primarily my own issues of balancing life, work, and a kid. As
Mm.
far as like school goes, I'm a pretty big nerd, so I didn't really have to study much. It was really easy.
Okay, good. Just making all the rest of us look bad. Okay, so
Sorry.
was there anything in nursing school that you felt like really drew you to psych nursing specifically, or did you decide later on that you wanted to be a psych nurse?
I had actually gone into psych nursing prior to finishing my RN. It was more of a fluke. It was like
Oh.
I was done working in nursing homes and different places that wouldn't accept my degree. And then I ended up working with kids in
Mm.
psych and learned that it was my niche. And so I continued my education and I'm hoping to get my doctorate so that I can be a doctorate nurse practitioner in psychiatric care.
That's awesome. Are you pursuing that currently, or that's just in your future?
Yes,
You are? Oh my
pursuing it
goodness,
currently.
girl. That's
I know.
awesome. Congratulations.
Thanks. Thank you.
All right. So Laura Nelson asked, what did you do prior and how did it prepare you? So you mentioned a little bit about some stuff that you did prior. How do you feel like it prepared you for psych?
Um, I did a lot of different things in nursing. I did ortho, I did surgical, med surge, I did some mother baby. I've done a few different types of nursing, and I felt challenged, but not nearly as challenged as I knew I could stay busy doing.
Okay.
So, in a sense, I feel like all my experience with med surge, with ortho, with families is what led me to understanding people and the dynamic of whole person care better. So I use my skills quite often still just to achieve whole person care. So that's where I got a lot of my experience.
Do you feel like a nurse needs prior experience before going into psych?
No, not necessarily. I do feel that there needs to be a level of understanding,
Okay.
a personal check of yourself, and also it wouldn't hurt to know about people in trauma informed care, learning how trauma may work for or against you in settings where you're helping with the mentally ill.
Sure, that's a good point. To those of you that are tuning in, welcome. If you have questions, just get them in. And as the conversation flows, I will ask your questions, okay? So, one just popped in. What advice would you give to nursing students going into their psych clinical rotation?
Do not be afraid. Mentally ill patients are just people. They're not looking to attack you or hurt you. In fact, it's the opposite. They're usually just wanting to get to know you. A lot of people with schizophrenia carry a level of paranoia that inhibits their ability to communicate effectively. So they give blank stares, laugh inappropriately, maybe even respond to internal stimuli. It doesn't mean they're going to attack you. It doesn't mean that, you're in danger. It just means that they have an illness. And just like anyone else coming into an urgent care setting with a cold, you would treat them as the same way. Don't be afraid.
Sure. Is there anything specifically a nursing student can do to connect with someone in a psych facility or maybe a group of people that you would recommend?
I think for nursing students, particularly, there's kind of a limit to what they can experience in the psychiatric setting.
Okay.
And so that kind of dampens my advice. But my best thing is to get in there and learn about the people experiencing those disorders. Whatever it takes, if it's drawing, there are several universal languages I call love, listening, music. There are different things you can do to relate to another human being who may not be able to relate to you on a way that we normally see fit. So there's always a way you can draw a picture, play a video game or play games, cards, anything that brings out a person's personal identity.
Sure, that's great advice. So, as a psych nurse, do you have patients try to be inappropriate with you?
Inappropriate in what way?
Um, Heather, do you want to elaborate on that? How are you asking in terms of inappropriate in what way? We'll move on, and when you hear back from Heather, we'll approach that question.
Okay.
Working with mental health. Oh, sorry. Let me read that again. Does it help having mental health issues working as a mental health nurse? Yes, I read it right the first time. Sorry. Go ahead.
Um, Experience is definitely a plus anywhere that you go. I don't know if it would help or hinder. I guess it depends on what your experience is, how far along you've recovered, how much your insight is into your own illness. It does help as far as compassion and understanding someone else's situation or why they may or may not want to take medications. I
Mm,
personally do have my own psych history, which is what kind of opened the door for me to learning more about it. So I would definitely say it's helpful as far as experience goes, but it's not necessary.
okay. So Heather got back to us with an example. She said something like, well, she's a sexy chocolate mama.
I am, aren't I?
I knew you would appreciate that. That's why that's so funny. All right, Heather, you
Well,
totally hit the nail on the head, especially with Jaeda. Anyways, move on.
exactly, especially. So for me, dealing with that, I'm going to tell you right now, I get it every single day that I work. I have one patient in particular who has dissociative chronic paranoid schizophrenia. And there are moments where he's with us, and then there are moments where he's just completely dissociated. And when he's dissociated, one of my favorite things to do is go up and do a side bump with him and be like, "It's me, your Mushaki," so that he can kind of gain back reality. And, when he does come to, he's like, "You're so beautiful. I'd marry you if I could." It's flattering, definitely. But I also remind myself that it's a human thing. And if they ever cross the line, I usually just explain, you can't talk to people that way. I don't appreciate it. It hurts my feelings, makes me uncomfortable. A lot of times, someone who's got a mental illness has never really been told what it is that they're doing inappropriately
Mm,
in such a light manner. So, for example, I had a resident completely stripped naked and ask me to assess his man parts. And, most people would freeze up or take off running. And my response to him was, well, I'm able to assess them just fine with your clothes on. So how about you go put some clothes on, come back, and we'll talk about what's wrong.
yeah.
Yeah.
Good points. So we're going to have lots of questions coming in. This is drawing a pretty big audience. So I don't know how many of the questions we'll get to that I sent to you earlier. We'll try and work them
Sure.
in. All right. So how do you learn to become aware of your surroundings and patients so to keep yourself safe while administering care to volatile patients?
For me, staying aware is something that I just naturally have the ability to do. I've always been very keen and insightful to my surroundings. As a daughter of a firefighter, and I also have two older brothers that like to pick on me, I learned very young how to stay aware of my surroundings and respond. Um, my best thing that I do is whenever I have that inside, we call it the spidey senses, when they start tingling, or your gut intuition, it is your best friend because it'll never let you down. And when I'm feeling compromised, I will definitely turn, face the patient, put my hands up and say, "You're in my space, you're making me uncomfortable." When all else fails, just turn around and leave the situation.
Sure. How do you keep from losing hope or becoming jaded in such a heavy field of work? So that's something that I was also wondering, and wonder often with psych nurses. When I did clinical rotations there, or when I worked in psych as a CNA, I was a traveler CNA, so I was there for a very brief period of time. I
Yeah.
felt like I saw the same patients over and over with the same issue. I stopped taking my meds, med and compliance. How do you keep hope? How do you keep doing your job day to day?
Exactly. You know what? That is a really, really big one because for the mental health community, or anyone who has to take meds to keep themselves on track, so to speak, I have to remind myself that medication, the five or six, seven, eight, I don't know, cardinal rights now. One of them is the right to refuse. I have to remember these are individual human people. And even though I may know what's best for them, I may have seen you stop taking your medications, you decompensate, and you're back in the hospital. A lot
Mhm.
of my residents are chronically mentally ill. They've been through the system several times. They are what we would call frequent flyers. Nobody likes that word, but
I
they
know.
do enter the system quite a bit. For me, my best hope is if any day of the rest of their lives is a positive one and we've accomplished them taking their medications and staying safe, then I've done my job. Because a long term expectation of someone who has a mental illness to stay on medications that hurt your body, have really wicked side effects, you have to empathize. I mean, if you knew taking a pill every day would make you very skinny, but also very ugly, you make the decision, well, I do strive to be skinny, but how do I deal with being ugly? Well, tomorrow I won't take my pills so I can be beautiful, but I'm back fat again. However you look at it, it's essentially down to understanding humans have their own choices, their own rights, and my job is to fulfill their happiness in whatever way sees fit.
That's a good analogy. I've never heard that one before, but I like it. So, something that someone put out there, and I didn't catch the name of this person, but what are the different types of psych facilities, inpatient versus outpatient? What are those roles?
Okay, so there are several different facilities for psychiatric help. There are different levels, say to like in the hospital you have level 1, level 2, level 3 emergencies. It's the exact same way. Inpatient psychiatry is just that. It's someone who's presumed completely unstable, needing the assistance of medical intervention, and in some cases medical override, which is where we get into restraints, seclusions, and injectable medications against someone's will,
Hmm.
and that's a really fine line as well. And then you have your outpatient setting, which is more people that are stable for longer periods of time on their meds, and they're able to check in and maybe come once a month should they get monthly injections to control their symptoms as opposed to a daily pill.
Yeah.
Then you have where I'm working, which is an RTF, a residential treatment facility. Some of them are short term, where they come and they get stabilized and they're back out in the community in a couple of weeks. Some of my programs, it's a few months. You have 3 months to get it together. The program that I'm currently working at, I've had some guys that have been there for 10, 15 years, and it's because their disease has progressed to a point where they're older male adults, maybe in their 50s and 60s, and mental illness doesn't get better. There's no magical pill to fix it.
Hmm.
So they live there longer. We're helping them learn to cope with their symptoms worsening. We're helping them learn to, remember things like showering, washing your teeth, and bedding. So there's those different levels. There's also psychiatric emergency, which is exactly what it sounds like. It's the emergency room for a psych patient. And that can get pretty interesting as well. I worked at UNMH in the psych ED for a little bit, and that's definitely a fun place to learn a lot about psych.
Sure. If you were to suggest someone starting in one of those areas that's really passionate about psych, where would you suggest they start?
Wherever they feel they can be the most effective.
Okay.
Um, and really, it's all based on your level of comfort. If you don't mind dealing with emergencies, the psych emergency room might be for you. It's a higher acuity. You know, you're bringing in people who have either been completely non-compliant with medications or are completely unstable. They could be suicidal. You
Right.
know, it's based on your level of what you're willing to do. I prefer the residential care because, like I said, it's the continuity of care. I get to see the work that I do with people have a lasting effect.
Sure. That's interesting. That I didn't realize the levels. That is really interesting. So Charmaine Platten asks, what are your tips for managing child psych patients with severe autism who are agitated and unable to communicate with you verbally?
So, what I've come to realize is autism, even though they try to put it on that spectrum, it's not a mental illness. Autism is actually a developmental or a social illness. And so that has to be set aside from their mental health. If that patient, usually with autism, they have a lot of sound sensitivities, sensory issues. So it's always best to approach with sensory care, and then you can get someone to open up from there. A lot of times, I actually have a male resident who is in his 60s. He's autistic, and he also has chronic paranoid schizophrenia. And I've learned in treating him, I have to approach, give him a chance to respond, speak clearly. Don't rush at him, you know, no loud noises. Don't come from behind to tap on him. There are different things that you can do to approach someone with autism, to get them to be more compliant or more comfortable. It's really about their safety, and that's where the behaviors come from, is a lack of feeling safe.
And maybe this is my own perspective, but pediatric ICUs, you see fair number of autistic kiddos, and it really is dependent on the patient, right? I mean, some of them,
Absolutely.
like you were saying, it's touch, some of them it's noise, some of them it's stranger anxiety. I mean, you could just go on, right? So I feel like I learned best from my child's caretaker, but in a psych facility, maybe that's not a real good reference point.
True, true. And I think when it comes down to managing behaviors, the expectations for those with mental illness can be just the same for the expectations of those without. I believe everybody is capable of something.
Yeah.
And as long as we reach to the strengths, you're more likely to find a resolution. So maybe the person that you're treating the child um, gets really nervous and they do a lot of arm flapping. When you try to pull them to the side, they start screaming or cussing. Instead, you know, take a step back, maybe hand over a soft plush toy, give them the chance to come to you. That's always a good way to work. And unconditionality, it's tough to be someone who has issues and see others constantly respond with fleeting. So my best thing is whenever someone is having a meltdown or they're in crisis, I will approach my side to them. Never face front or turning your back, but definitely approach and just stand side by side. No eye gazing, just pure presence. And that can be calming.
That's good input. This is her question was twofold. And then she also asked, "What are your tips for helping child psych patients who are acting inappropriate in the day room?" And she gives examples of cussing, yelling, or interrupting other children's playtime.
Same thing I do with my kid who's being really, 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 really bad. Sit down, shut up. No. But really, it's behavior expectation is universal. You know, whether or not they have a mental health issue, I like to tell people, you don't have a sign above your head that says, hey, I'm bipolar. This is why I'm acting this way. You know, everybody responds to how you behave. So if you're cussing in the day room, we're going to move all the kids out. You can have your tantrum. And when you're done calming down, we're going to talk about a way that you can approach that better.
Mm.
okay to have those emotions, okay to have those reactions, but it's not okay to cause others to feel unsafe.
Yeah, I like it. Someone says, I'm coming in late and may have missed you talking about this, but what have you worked with all ages? Do you prefer pediatric or geriatric?
I have definitely worked with all ages. I love peds and adolescent psych. I really do. The hardship for me there was dealing with, because a lot of times children with psych issues or being admitted to treatment facilities come from backgrounds where trauma is hefty. So that was the hardest for me, was dealing with the parents of children. And I've also found sometimes it's kind of hard to draw the line between wanting to be a mom and and so there would be times where kids would want something, and I knew they needed a hug, but therapeutically at that time, a hug wasn't appropriate. So it was definitely hard for me to say goodbye to peds, but I think for my own mental wellness for a little while, it was a good idea to go to adults. Plus, I'm not looked at so bad if I tell an adult to go screw yourself. So
Yes, true. So, what certifications are possible in the psych field? Are they required at a certain point?
Well, for my state here, I'm in Oregon now. In New Mexico, before where I gained all my practice, they didn't really require anything besides a nursing degree. Since I've been out here, they have what's called QMHP, Qualified Mental Health Provider. I had to get certified in, not only am I a nurse, but I can also provide accurate mental health assessment and provide the care. So that was a test that I had to do online. Also, to stay up to date with my abilities to hold seclusions or do medication overrides, any kind of injections, I do have to do yearly training. One of them is called CPI, which is a form of early intervention before things get too elevated. It's a way to de-escalate the situation. I have to learn every year how to do seclusions and restraints the proper way each time so that no one's getting hurt.
Mm-hmm.
CPR, all the same stuff you would need to stay a regular nurse, just the extra added psych assessment, suicide assessment, and anything else that's really good for mental health.
Is it a certification? Like, for instance, you can have your critical care certification. Is there a psych specific certification?
Not necessarily, no. I think there should be.
Yeah.
Um, like I said, in some states, it doesn't matter. You can just be a nurse. Out here, they require you to be a QMHP, and that's a certification that you have to get
Okay.
prior to becoming a nurse.
Prior to becoming a psych nurse?
Yeah, sorry, psychiatric nurse,
Okay.
yeah.
So most certifications that I'm familiar with, you actually have to work in the field before you can obtain that certification. It's different for psych.
Well, yes. Actually, some places will still just hire you and then allow you within the first 6 months to obtain those
Okay.
certifications. Mental health is such a brand new baby of healthcare. It's still developing the do's and don'ts.
Yeah. And hopefully it continues to develop. Hi,
Yeah.
Lisa. So, Savannah says, I've always had an interest in mental health, but my visit to the mental health hospital here in New Mexico during my clinical rotation kind of scared me away. What were kind of thrusted into acute admissions and locked facility? What do you suggest to address these fears?
Checking in with yourself. Why are you afraid about that person that is triggering you to have a reaction that way? It is intimidating. I do sometimes still walk into my place of employment and I'm like, oh man, I wonder what mood so and so's in today. Am I going to get spit at, kicked on, something thrown? Am I going to see genitals? I don't know what's ever going to happen. But I check myself before I come in. I try to do whatever it takes for me to be in a calm, happy mood. Because believe it or not, your mood is just as inheritable as conversation. So if you come in a really pissy mood, somebody is definitely going to pick up on that. I call it dog sense. Like if dogs can't communicate with us, but you show your fear, they will definitely come after you. So it's good to check yourself, how you're feeling about that. And to remember, they are just people. They just have these things that might make them a little unpredictable, but so do others in public. You can never tell who's got an issue or not. So just to remember, their goal isn't to hurt you or to hurt themselves. Their goal is usually to get better.
Sure. Good points. Let's see, what else do we have here? How do you decompress after a stressful shift?
I work about 30 minutes from where I live. So my ride home, I will legit sing karaoke. I do. And then when I get home, I may sit in my car and finish a song or two. Anything that I do that brings me joy. I also like to sleep. Sleeping is good. Just self-care, daily self-care is important. Even if it's something small, like buying yourself your favorite coffee from Starbucks or taking a walk, anything small to keep your personal level of comfort balanced, and you can move mountains.
Ashley asks, I'm concerned about not being an effective therapeutic communicator, but really want to make an impact on my patients. Do you have any advice for introverted people in the psych field?
Yes, find your niche. You like music? If you're good at music, you play music. Do you like coloring or art? If you're good at art, do art. Whatever it is that you're good at, it's always good to help bring others' strengths about. And remember that your clients are worried about therapeutic boundaries just as much as you are. So only give as much as you're able to handle. So if you've got someone really wanting attention, they're constantly at your med window for PRNs, and really all they're wanting is a conversation. Find out what kind of music they like. Maybe sit down, turn on some Spotify, and hang out for a minute. It's the people around you, and you can predict a way to help.
Good input. We're having some breakup in our sound. Does anyone else have any questions out there? I'm going to close with just a couple questions here at the end. If you guys have questions, you better get them in before we let Jaeda go. So, interview tips for psych overall. Do you have anything specific? Oh, there was another thing. Actually, I skipped it. Are you ever concerned about nurses who want to leave psych after an extended period in psych that they will not be able to get a job elsewhere?
No. I actually find whenever I go to large conferences and everybody's talking about what kind of nursing they do, as soon as I say the word psych, you get the head tilt. Oh. So you're almost seem like a superhero because they're like, how do you do it? I could never. And in psych, you
Right.
have to have your skills well rounded. I have not lost my IV skills. I have not lost my injection skills. I haven't lost any of my skills. In fact, I find I'm using them more and more of the ones that you kind of get lost on. That's because mental health almost gets its own bad rep. So when we send residents to the doctor or urgent care settings, as soon as a mental illness is rude, they are usually shunned or pushed to the side. So I've found it best for me to, I don't know if you can still hear me.
Yes, I can hear you. Are you frozen? Uh-oh. I can hear you.
Hello?
I can hear you. Can you not hear me? I can hear you. That's odd. I can hear you, Jaeda. Keep talking. She must be experiencing me being frozen. That's odd. Okay. Let's see. Let's see here. Talk. Oh man. Bummer. I don't know why she can't hear me. Yeah, obviously she can't hear me, but I can hear her when she was talking. I know. I'm sad. I think, oh well. Okay. Obviously we lost her. Thank you guys for all of the input and questions. All of you will be entered into the prize drawing for the Q&A. I think she'll tune back in. She just messaged me. Sorry, I'm telling her to tune back in just so we can end our questions here. But anyways, I will do another drawing of all those who have commented, and I'll do an announcement again right after this, just so you guys know that you won. She's back. Hopefully we have a decent connection. Let's see. I will ask her the drug abuse question. And hi, you're back.
I'm back.
Okay, good.
Sorry about that.
You look like my internet that sucks at home. Okay, someone just my it could be. Am I breaking up and Jaeda's breaking up too? All right. Anyway, someone asked, do you think drug abuse is where is the question? Let's see. Do you think drug abuse is a major issue, including self-medicating?
Absolutely. The facility that I specialize in is actually a co-occurring facility. So most of our guys not only have the psychiatric component, but they've lived on the streets and have other drug abuse issues. Because mental illness is such a stigma in healthcare, a lot of people do not want to seek healthcare. They feel the word crazy is attached. And so, initially, to help with any feelings of inadequacy or maybe even how to respond to voices, you see a lot of drug use. And that sometimes compounds and makes mental illness worse.
Okay. So it looks like both of our connections stink, or maybe it's just mine. I'm not sure. But we'll close out with, what's your favorite part of mental health?
I'm always reminded that I'm more crazy than my patients. So whenever someone's throwing a fit and it's really getting to a level of everyone not wanting to be involved, I like to assert my crazy and remind them that I'm on this side of the wall because I'm medically compliant. It's the only difference.
Awesome.
Relativity.
Last question is, any interview tips for people who are interested in going into psych?
Absolutely. Know about suicide assessment, trauma-informed care. You also want to know a lot about your rights of medication administration. That's a big one. And the last thing is know your psych drugs. They're ever evolving, but know them, know the side effects, and any potential dangers.
Good, good. Sorry, one more question because someone just
Okay.
entered it. Mental health seems to be taboo to many people. Do you feel that in your work?
Absolutely. It's one of the main reasons I'm attaining my degree to get a doctorate. I'd like to actually open my own mental health facility here one day. I feel like as soon as a resident is attached to a mental health diagnosis or, an Axis 3 or diagnosis, they're initially treated as someone who could be delusional, lying. So a lot of times care goes unseen. I had a resident who was presenting as his primary care physician labeled him polydipsic, psychogenic polydipsia, which I'd never heard of my life, and did some research, couldn't really gather why. I took the initiative to get some labs ordered with the doctor, checked out his HbA1c. Turned out the poor guy had been diabetic. So, of course, he'd be polydipsic. But they threw the psychogenic in there because nobody had checked whether or not he had diabetes.
Wow, interesting. All right. So, any other questions before we tell Jaeda goodbye for real this time? Thank you for tuning in. This was great. So many people have said thank you for doing this Q&A. A lot of people said I was so nervous. I'm so excited to go to my my clinicals now. So your time has been greatly appreciated, Jaeda.
Great. Happy Nurses Week, everybody.
Happy Nurses Week. Thanks, Jaeda.
Thanks. Hi, Tony. I told her I'd give her a shout out. So.
Oh, good. Perfect. I'm glad you committed.